Ashy dermatosis, also called Erythema Dyschromicum Perstans, is a skin condition that creates flat gray-brown patches that look like ash on the skin. The patches usually appear slowly and stay for a long time. It is not dangerous, but the color change can be worrying for people who notice it. The exact cause is not known, but doctors think several things may trigger it. A weak or altered immune response, the body's defense system. Exposure to certain chemicals, like latex or hair dyes. A viral infection, some viruses can change skin color. Genetics, it sometimes runs in families. Because the cause is unclear, the condition is called idiopathic, unknown origin. One or more round or oval patches that are ash gray, brown, or slate colored. The patches are flat, smooth, and usually 1 to 2 centimeters wide, but can be larger. They appear most often on the neck, trunk, arms, or legs. The skin inside the patch feels normal, no itching or pain for most people. If you look at the back of your hand and see a faint, uniform gray spot that did not exist a month ago, that could be an early sign. Diagnosis is mainly visual. A dermatologist will look at the color, shape, and distribution of the patches. Ask about any new medicines, chemicals, or infections. May take a tiny skin biopsy, a small piece of skin, to check under a microscope and rule out other conditions. Treatment options are limited because the patches often stay for years. Options include topical steroids or calcineurin inhibitors to try to lighten the color. Effect varies. Light therapy, narrow-band UVB, in some cases. Cosmetic camouflage makeup for people who want the patches hidden. Patients are advised to monitor the patches and report any changes, such as rapid growth or new symptoms. Since the exact trigger is unknown, true prevention is difficult. However, people can lower the risk of making the condition worse by avoiding known skin irritants, for example harsh chemicals, certain hair dyes. Wearing sunscreen daily to protect the skin from UV light, which can darken existing patches. Keeping a diary of new medications or exposures, and sharing it with a doctor if patches appear. These steps help reduce additional skin irritation that might aggravate the color change. Recent research 2022 to 2024 focuses on the role of the immune system and genetic markers. Small studies have found higher levels of certain immune proteins IL-6, TNF-alpha in the skin of affected patients, suggesting an immune-mediated process. A possible link to a gene called HLA-DRB104, which may make some people more prone. Early trials of low-dose, oral isotretinoin, a pill used for acne, showing modest lightening of patches in a few patients. These findings are still preliminary, but they give doctors new directions for future treatments.